Hi, my name is Abigail Baird, and this is Athletes and Eating Disorders Cognitive Behavioral Therapy as Treatment. This is for Social Work 5322. So we're going to go ahead and get started. The first area we'll look at is the introduction and the topic area. So the focus of this research is testing the effects of cognitive behavioral therapy as treatment for cases of eating disorders, specifically those found in athletes. And the prior research done here, it kind of is split into two areas. So this research specifically hopes to tie these two areas of knowledge together, and that is the body of knowledge that exists about eating disorder cases found in athletes and the frequency of that, and the body of knowledge around cognitive behavioral therapy and its effectiveness as treatment for eating disorders. So what we're looking at here, there's an examination to be made about just the lifestyle of those um, who are athletes, the competition, the pressure on body image, the need for control and perfection, and the varying qualifications that different sports have that create pressures on athletes, and the way that their brains become wired to be professional athletes, and that lifestyle kind of lending to CBTs being effective due to how they seek to kind of rewrite how the brain formulates habits and rhythms, and we just see that that method might be the most effective in treating athletes more specifically. So the importance of this research to social work is, of course, to add to the body of knowledge that is kind of lacking in these two areas that we're hoping to combine, and to make way for practice and policy changes. So that may look like creating better educational programs to educate athletes on health and wellness in their specific lifestyle, just kind of create changes that will decrease that amount of athletes who experience eating disorders, see what we can do to bring that down. And of course, it could create a presence for social workers to join athletic departments so they can be a resource in this phenomenon here, and be ready to administer CBTs if they are effective in this arena here. So we'll move on to the research question and hypothesis. So the research question here is, what is the effect of cognitive behavioral therapy on the symptoms of eating disorders in athletes? So our hypothesis is that the administration of CBTs will decrease the symptoms of eating disorders in athletes. The variables we're looking at here, the symptoms to be measured by the surveys act as the dependent variable, because the variation and measurements to be determined by the independent variable here, which is the CBTs as treatment. Um, so we're looking at changes in eating disorders that are caused by this treatment here, the administration and the effectiveness of CBTs used as treatment in response. So our hope, of course, as always, is to add to the body of knowledge, like I said earlier, but our hope here is that CBTs will be used more widely in athletic departments if they are proven to be very successful in decreasing those symptoms in eating disorders, and that social workers will be more equipped to understand the person in environment circumstances of athletes, specifically those elements I spoke of earlier, the competition, body image, and control, um, that are present in that lifestyle, that hopefully helping professionals will be better equipped and more likely to understand that lifestyle and those circumstances in order to provide the highest amount of care that they can. Next, we'll look at methodology. So the type of study we're looking at here is evaluative. So this study seeks to determine the impact of a form of therapy, specifically CBTs, on a specific phenomenon, which we're looking at eating disorders. So we're trying to evaluate whether or not this is the most effective type of therapy for disordered eating habits. The design we're hoping to use is a single subject design, basic A-B format. So this is designed for research, evaluation, and client monitoring. So it uses a measurement at the baseline phase and a measurement at the intervention phase in order to measure the progress in between with the specific type of therapy that we'll be using. So next we'll look at the sampling methods. So the population we're looking for here is athletes with eating disorders, and in order to find this population to study the effects of CBTs, it's going to be a purposive sample. So that means there's a specific need that we're searching for, and then we'll use convenience sampling, and that's going to be found by asking specific groups for participation and utilizing the responses that we get in response to that. So we'll obtain this sample by contacting athletic associations, and that's collegiate and professional, in order to inquire about participation by some of their athletes. And we will, upon agreement and contracts, we will administer our standardized assessments that will detect the early signs of disordered eating, and that will develop our sample. So we don't want to be using therapy on those who don't show any signs of disordered eating. Then we will administer CBTs as treatment to that group that we find from the standardized assessments, and after each subject's allotted amount of treatment, we will administer the same assessment again to measure the progress of their symptoms. And then finally, we'll hold some kind of debriefing or counseling session to just kind of gain some more understanding on the subject's perception of the success of their treatment and just their experience with the therapy in general. Next, we'll look at measurement methods. So the method we're going to use is some standardized assessments that are used to kind of detect disordered eating habits. So first we'll use eating disorders inventory, then eating disorders examination, and the eating attitudes test. And these will be administered in a pretest form. So before the independent variable is administered, that cognitive behavioral therapy as treatment, we will test and gain some quantitative data, and then we will do the therapy, and then we'll have a post-test of the same assessments to determine the progress. So these assessments are valid and reliable measures because of their credibility, their previous use, and their proof of success in previous research. And then we'll do a little bit of interviewing as measurement towards the end, and a debriefing appointment after the post-test. And that's, again, just to gain a little bit more perspective, a little bit more information about the progress and the perceptions of the subjects about the specific forms of therapy used and their effectiveness. Next, we'll look at some limitations. So, with working with athletes, there's a little bit of sensitivity that is involved. Their job, their scholarships, their well-being can hinge on their ability to perform in the sport, and a social worker discovering a health risk could be detrimental to their well-being. So professionals should develop sound contracts and agreements with the athletes and the athletic departments to provide some safety and security to the athletes that are participating in this study. Next, when we're working with surveys, we have to realize that surveys are subject to a participant's willingness to self-disclose. So that can sometimes threaten validity because people can say whatever they want on a survey to ensure that they don't become inconvenienced by their own responses and the consequences of those responses. So we are hoping that administering these surveys in a group setting with plenty of explanation and agreement on the contracts beforehand will encourage a greater deal of honesty on these surveys. Next, the sample provided will gather kind of a wide range of severities in the disordered eating habits and the eating disorders themselves. So we're hopeful that the that varying the lengths of treatment and the discernment on behalf of the helping professionals that are providing the treatment will help us to maintain external validity in the reproduction of these results, because they will cater to the specific needs of the specific subjects and their severity. Next, the results of this survey are meant to test the impact of CBTs in this specific population, and the use of standardized assessments should help us to establish internal validity and to understand that cause and effect relationship between CBTs and eating disorders. So that will be measured in the pre-test, in the post-test, and the changes between the two. That's how we will measure that cause and effect relationship. And then finally, there's always some room for error when working with human subjects, and specifically working with those with eating disorders due to their uniqueness in varying severities and types. So random errors can occur with the assessments shown. The assessments can show results with wide variations in disorder severity, and systematic errors can happen when questions may overlap in an assessment that offer kind of different conclusions. So our hope is that using these widely used instruments can help us to know that our method has been used before and has been successful before in gathering the data we're hoping to gather, and that those instruments are reliable in that way, in hoping to weed out some of these possible errors. So, in conclusion, we are hoping to find that cognitive behavioral therapies prove effective as treatment for eating disorders, specifically in our population of athletes that struggle with eating disorders. We hope to find that to be an effective method, so that programs and policies can be established that will provide better education and better counseling opportunities for athletes to gain a better understanding of nutrition and wellness, and how they can take better care of their bodies in the season they're in the careers that they're in, that they are well aware of how they need to nourish their bodies to be healthy. So further studies could be done on this subject. I mentioned a little bit earlier the factors of the athletic lifestyle, such as competition and perfection. Those things could be studied a little bit more to better understand why the eating disorders come about, how we could prevent those rather than just treating them. So this study is just to test CBTs as treatment, but there could be more to be looked at in that lifestyle, and how we could kind of rewrite the way that we teach athletes to participate in their sport, and to make sure that they're seeking wellness and health over performance. And if this study is unsuccessful, the research at least will still contribute to the body of knowledge. Like I said, it's a little bit lacking in some of the areas that this study covers, so it'll contribute to the body of knowledge, and hopefully a search for better, proper, and effective treatment for this widespread problem of eating disorders in athletes. That search will continue, so that a good and effective form of treatment will be found that could be implemented into athletic departments, that would be found and used, so that this problem doesn't continue to grow, and that we can change the way that we teach and train athletes to make sure that they are being healthy and make sure that they're making good choices for their body and not just for their performance in their sport. So, even if it is unsuccessful, our hope is that someone will continue to find ways to reach out to athletes with eating disorders and that there will be a long term solution to that problem so that it's not such a big one anymore. Thank you for listening. This has been Abigail Baird looking at athletes and eating disorders and the effects of cognitive behavioral therapy as treatment. Thanks.